Access Health, a new kind of healthcare. Lower premiums for employers. No copays or deductibles for employees. Better access, better health. Access Health.
Access Health is probably the most innovative healthcare concept I've seen in 40 years. The patients will most likely go to a Access Health clinic because they pay no copay, no coinsurance, no deductible. It's very important for us to be able to remove the barriers and hoops, and that's what Access Health does.
What we want to do is allow that patient to benefit from open access health care and when they need it, and that's the model that works.
Access Health is a great program. Very often the employee has not developed a relationship with a provider, and so it gives them quick access when they need it to a provider. So I think it's a win-win. I think it's a win for the employees, it's a win for the employer.
As an employer, we have found, I would say, at least two primary benefits. First and foremost is for the employees. Not only can they receive quick access to quality health care, it is at no expense to them. Another benefit we have found with Access Health has been the reduction in our healthcare expenses. We have been able to hold our employee healthcare premiums flat with no raises for 2 years now. That's a remarkable benefit for them.
We saw a net benefit in the sense of what we were paying out in premiums for Access Health Access. We were seeing a savings on the claim side, almost, so it netted it out. So it was at zero cost really for us to offer this benefit.
Access Health has been terrific for us. Our absentee ratio is way down because you don't have to wait 2 days to go to the doctor. You can go see someone right away, and going to Access Health takes care of the problem.
As an employer, certainly when we're looking at having a happy workforce and a content workforce, that reduces our turnover. Turnover is very costly, and everything that we can do to keep that ratio low, it really helps us. It's been a wonderful recruitment tool for us to be able to tell potential employees that we have Access Health as part of our benefits plan, and I think it certainly has helped us in our retention as well.
One of the other benefits is we have employees who have dependents that may live throughout the state. One's in school in Monroe, or one's down in Baton Rouge, or in Lafayette, or wherever. And it's a great benefit as those college students, in these particular cases, can go to that local clinic and enjoy the same benefit they would have if they were at home in Natchitoches.
Any size employer can be in Access Health. We have one employer that has two, and then we have some that have 3,800 to 5,000. It really doesn't matter. Access Health works for any size employer. It's creating a healthier workforce, and it's because about 42% of the employees we have found when we do employee meetings, they don't have a primary care physician, and so that means they go to an emergency room when they're really, really sick, and then they really don't have any follow-up care from that. So for an employer to have that 42% of their employees to actually go to a physician and or a nurse practitioner for a visit, magic things happen.
The main thing about Access Health is that it fills in the gap for what is wrong with our healthcare system in America. We don't have the luxury just to wait in line for an hour and a half. And this product really allows you to be able to go in there, get looked at very quickly, and it's not just a matter of dealing with an illness such as the flu or you have a cold that day. It does so much more than that.
I think the biggest benefit of Access Health is the fact that for the employee, they're able to come immediately and be seen without having to pay a copay and without having to pay a deductible. A lot of times, especially early in the year, if their insurance has a high deductible, they won't seek out care because they don't have the funds to do so. With Access Health, they don't have a deductible or a copay, and they don't have to run through a lot of hoops to be seen. They go to a desk and they check in and they are provided care.
I would consider it an employee benefit just because there's very low wait times. There's no copay.
As an employee and a patient, I've been here various times, and the quick response, the professionalism, the fact that you don't have to pay anything. You come and you see the appropriate medical person. I found the medical staff to be top-notch. They have addressed all of the medical issues. They called in scripts, and I've gotten back to work with appropriate treatment very quickly.
One of our mottos is keeping hometown money at home. When we started Access Health, we had employers all over the state of Louisiana where we started with Access Health. And it was very important to us to be able to work with providers and have a contract with providers in the community because we wanted to keep hometown money at home.
Physicians that want to participate in Access Health are going to gain a continually growing block of patients from the employer model. This is one of the first things that physicians complain about is business regulation compliance issues. And so they get to actually practice medicine.
Another benefit with Access Health is, for our employees that, hate going to the doctor or scared to go to the doctor, I think in many ways it has humanized the experience for them, that they are comfortable coming to the clinic. They're treated, as I said, very respectfully with their time. They're listened to. It's such a positive experience. I do believe that employees that may have been at risk for high blood pressure, diabetes, any other condition that might have gone left untreated will come to Access Health because the process is very, very easy and it's not frightening for them.
Long term, we're looking at a payback within a year from everything we've evaluated. And it's because of that. It's the cost of traditional hospital delivery services versus accessibility of care.
Access Health is a win-win-win for all parties. It's better for the physician. It's better and gives access to employees who might not have access to health care. And for the employer, it brings them, first off, a healthier workforce. And secondly, it allows them to really control their costs better over time because of what the Access Health model does for them.
The new model of healthcare, Access Health.